just to take a little step back, if you look at how we started this project, our founder has been involved with AI, but primarily in the oil industry prior to coming aboard. He and his wife had multiple pregnancy losses, and he felt that there was nothing adequate to really demonstrate, which pregnancies were at risk, which pregnancies were not at risk, and decided to go ahead and try to do something through artificial intelligence. And again, if you look in the United States, about 10% of pregnancies end up preterm. That's about 380,000 pregnancies a year. It is the second leading cause of neonatal mortality and the main cause of child mortality under 5. So it is a big problem, and we have not been able to make a dent in it. Our current standards, what do we use for this? Are ultrasounds using cervical length, which have been around for a long time. Unfortunately, their sensitivity and positive predictive value is very low. In other words, it's not a great tool to determine who's going to deliver and when they're going to deliver. And so this, to me, is super exciting because, for one, we don't have a lot of tools that come up in pregnancy. Things are very difficult to study and get across. And it is unusual that we have something that has the potential to actually change patient management. Oftentimes we have something that, can slightly improve how this looks or can slightly improve how this gets managed. But it is unusual to have something that can actually change the way we look at things, on a clinical basis. And this is why I'm so excited about this technology. The way that technology is used from a clinical point of view is you sign up with an account, you register, you get a web name, you create a private login. So that information is wholly within your purview. It is HIPAA compliant. There's no information being sent out or lost anywhere, which is something really important when you're taking care of patients. The other thing that's very important is that this doesn't affect your patient workflow. It's very hard to use a technology that takes up a significant amount of time. So what this technology works, it works on first, second, and third trimester ultrasounds, although its use is in first and second trimester. And it works with the general ultrasound images that you are already having done. So, for example, most women in the United States come in for a first trimester ultrasound or a second trimester ultrasound, usually both. And when you do that, you either have a sonographer or a physician taking those images, recording them, and then using them to interpret. This is an add-on to that. So, you do the same images, the same scan, the same way. You send the images to our software. Our software analyzes it, and in less than a minute, it returns a predicted delivery date. So not a estimate, which is what we normally have, which is fabulous if you have a very, very well-known pregnancy date, but really very inaccurate when you don't have a highly well-dated pregnancy. So there's a big difference between our estimated date and our predicted date, which is a lot more accurate. So this allows the clinician to make decisions real time. You have an information point that is an additional information point in your clinical practice, and you can decide, if this information is significant. Are you going to look at the patient differently? Are there other ways that you may choose to either follow or manage or discuss, the patient's options, and then use that going forward to take care of the patient? So that's sort of the clinician's viewpoint of this. The technology works using ultrasound images alone. So it's not taking into account maternal characteristics. It really trained on just images, which is good because there is nothing that's biasing the AI. So there isn't particular, patient age or tobacco use or weight, things that generally can influence predictions. So that is a great thing. It's also a standalone, meaning it only uses the images that you give it. So if you do it on a woman, for one pregnancy, and then you do it subsequently on the second ultrasound, it's not doing it longitudinally. It's taking that second ultrasound as if it were the first. So, from a clinician's point of view, that's how it works. From the AI point of view, it uses machine learning and convolutional neural networks and transformers. And from, my physician understanding. It takes what we give it and initially analyzes it, and then it reanalyzes it using their own unsupervised learning and comes up with a result. As you know, any artificial technology that is in use benefits greatly from data. And so the more data that receives, the more potential improvement that it has. And actually, the pair study that was published in 2025 shows something to that effect.